Welcome back, everyone. This is Dr. Jenkins, as usual. So we just finished the skeletal lab, so it makes sense that we next move on to the muscles, right? Because it is the muscles that attach to the bones. So I just want to give you a little bit of an intro here about how to remember some of the names and just some other tips as we go through. So I've pulled up our lab for this week, okay? Let's see if I can get this out. Okay. So the first thing I'm going to ask you to do is to review joint movements. All right? And I've given you a nice little website here that's a really, really good descriptor. When you look at these joint movements, this is what we're looking at: flexion and extension, abduction and adduction, internal and external rotation, and then supination and pronation. So all this, what we're saying is when we move a joint a certain way, which by the way, we use the muscles to do that, but when we move the joints a certain way, they have names. And just like we talked about before, it gives us a common language that everyone in the health field understands. Let's first look at flexion and extension. If you look at this young lady here, if you flex your elbow, which is what most people say, you're causing flexion at the elbow joint. And what flexion means is that you're making a joint angle narrower. Okay? So when a joint is in a flexed position, this joint angle is narrow. 90 degrees would be straight up and down. So what's that one? Maybe 45 degrees? So we consider it flexion when the joint angle is narrowed. If she were to bend her knee, that would be flexion. Usually, in layman's terms, it would be bend. But if we look at the joint angle, if it narrows, it's flexion. Versus if that joint angle gets bigger. So the elbow here, what's the joint angle? 180 degrees. The way that she's standing, her knees are in extension, 180 degrees. So they're straight, they're not bent. But if you look at the joint angle, when it's narrowed or small, the joint is flexed. Or most commonly, it's when a joint is bent. An extension is when that joint angle is greater, or the joint is more straight, extension. Next, we talk about abduction and adduction. And this is why, especially when we have a lab in person, people think I'm so mean. Dr. Jenkins, she's so mean. Spelling counts, folks. Because here's an example where one letter difference changes the whole meaning of the word. So on the left, we have B, or abduction with a B as in baby. And then to our right, we have adduction, or adduction, D as in duck. One letter difference changes the whole meaning of the word. In abduction, we're moving the body away from the midline. So if we imagine a line going straight up the belly button, abduction, for example, the shoulder is abducting, it's moving away from the midline. The hip, it's abducting when it's moving away from the midline. This is going to sound crazy, but the way that I remember this is if someone is abducted, if you're abducted by aliens, you're taken away. Which means that adduction means the opposite. Adduction means to move that limb back towards the midline. Abduction, move away from the midline. Adduction, move it towards the midline. We have lateral or external rotation, and this is to twist. Sometimes it's called external rotation. This means to twist away from the midline. So again, if we draw a midline, a very crooked midline, but it's a midline indeed. Lateral rotation means to twist. Here we're twisting the ankle. You can twist at the torso, at the waist. You can even rotate your hips. So you can kind of twist your hip out, external or lateral rotation, away. So you twist away from the midline, or medial and or internal rotation means you're rotating in towards the midline, but it's more of a twist. Lastly, we have pronation and supination. These are terms we use pretty much only at the forearm. When you twist your forearm, either palms down or palm up, if you're twisting your forearm so that your palm is facing up, so if you twist your forearm so that the palm is facing up, that is supination. And I remember that because when my palm is up, I can cup my palm almost like it's a bowl of soup. So if I rotate my forearm to the palm up position, that is supination. Or if I rotate my forearm to a palm down position, that is pronation. All right, excellent. You're also going to be reviewing the terms origin, insertion, and action. So if we go back to this very first picture, here we have the muscle belly, right? Muscle belly. At either end of the muscle belly is a tendon, and the tendon is what attaches the muscle to the bone. And there will also be a tendon at this end. The proximal tendon, where it attaches, so if I circle where this tendon attaches to the bone, the proximal attachment, and we already know proximal means closer to the origin. So if this was the arm, this would be the shoulder. So this is more towards the attachment. It's more proximal. And then down here would be the elbow. It's more distal, further away from where the appendage attaches to the body. Well, the proximal attachment of that tendon is called the origin. So the proximal attachment of where that tendon attaches to bone is called the origin, which means that the distal attachment is called the insertion. And these are both, we're pointing to places where the tendon attaches to the bone. The proximal attachment is origin, and the distal attachment is insertion. Now, if you look ahead, you'll see at the end here, there's a table of muscle names. And if we were in person, we would be filling out some of these specific origins and insertions. But for this lab right now, you do not need to know any of the specific attachment sites. For example, the rectus abdominis originates on the rectus sheath of the midline. The rectus abdominis attaches on the pubic bone. So these are bony attachment sites where the tendons attach. But for right now, you do not have to know these. Okay? You don't have to know the specific ones for each muscle, but I would like you to know the definition of origin, proximal attachment of the tendon, and insertion, distal attachment of the tendon. Lastly, we're going to introduce agonist and antagonist. You can see the antagonist is down here. Agonist is up here. Let's say that we want to focus on a muscle. let's pick the biceps brachii. Everyone pretty much knows what that is. You probably call it biceps, but we're going to be more specific and call it biceps brachii, because there's another biceps that is actually in our lower body, biceps femoris, so it's important to say the whole name, biceps brachii. When the biceps brachii contracts, I'm about to draw some really bad drawings here, because I cannot draw for crap. So if the biceps contracts, or an elbow flexion, right? So remember we talked about when a joint angle is narrowed, and this elbow, so we're talking about flexion. Well, the muscle that causes that is the biceps brachii. So the agonist is a term given to the muscle that's creating the movement. So if we look at this bad drawing, the muscle creating that flexion is the biceps brachii. Now, what actually happens, let me change colors. There is also an antagonist, the muscle that is on the opposite side. So the yellow one was the biceps brachii. The green is the triceps brachii. There's also a muscle called the antagonist. And in this example, it would be the triceps. Whereas the agonist is the actual muscle creating the movement, the antagonist is the opposing muscle that relaxes. In other words, if both the biceps brachii and the triceps brachii contracted at the same time, you would have no net movement. So if we want to have the biceps contract, biceps brachii, to cause elbow flexion, they're the agonist. And the opposing muscle group has to relax. But what if instead of flexion, we have this little stick figure do extension? What color should I pick? We'll do purple. So instead of flexion, now I want this arm to be straight out. So now we're in extension. So now these muscles reverse their roles. When the elbow is extended, the triceps brachii is the agonist. If any of you have ever lifted weights, if you want to work your triceps, you do any kind of elbow extension exercise, because the muscle creating elbow extension is the triceps. The opposing muscle that relaxes is the biceps. So it depends on the movement. Whatever movement you're talking about, the muscle that creates that movement is called the agonist. But for the limbs, where there's a muscle on the anterior side, there's also a muscle on the posterior side. And if both contracted at the same time, it would be a dead standstill. There'd be no net movement. So the muscle that's actually creating the movement is called the agonist, and the opposing muscle that relaxes to allow the movement to happen is called the antagonist. Okay, my friends. The rest of this lab is just learning the muscles themselves. I'm going to go through all of them, so if you want to listen, do it. I find that the muscles are harder for most people to learn than the bones. I think something that plays a role in that is the names people view to be harder. For your lab quiz this week, you will have some multiple choice questions, And those multiple choice questions will come from the information I've already talked about. The joint motions, the definitions for origin and insertion, and the definitions for agonist and antagonist. Those will be multiple choice questions. Then there's going to be some labeling. Maybe there'll be a picture like this, anterior view, posterior view. And the labeling, just like for the bones, is short answer. So I'm going to go through all these muscles that you have to know, and I've given you some review websites. I'm going to go through them all, and we're going to fill these out. Let's start with the anterior side. We have this chest muscle, and that is known as the pectoralis major. I think most of us are familiar with our pecs. It's your chest muscle, both sides. There is a pectoralis minor, so that's why we have to be specific. Pectoralis major. The muscle that's right over the shoulder is called the deltoid. It's called the deltoid because it has a triangular or deltoid shape. Then, of course, we have the biceps and the triceps. I'll use the same colors I did before. On the back of the arm, we have the triceps brachii. It's called the triceps brachii because it has 3 heads. Tri is 3. On the opposing side, where's the orange? Let's go with the bright one. On the opposing side, right here, is the biceps brachii. So the biceps brachii is anterior on the front of the body, and the triceps brachii is posterior, or on the back of the body. We're going to label some of these muscles in groups. So for example, we have a bunch of forearm muscles, okay? On the posterior side, this is the palm side, right? Or the back of the hand. On the posterior side, this group of muscles is called the wrist extensors. So we're on the posterior side, which is also the same as the back of hand. Remember, we referenced everything from anatomical position. So the back of the hand would be the posterior side, wrist extensors. Whereas, if I skip ahead to this picture, we can see, I'll use a different color, we can see the palm side. So the group of muscles on the palm side are called the wrist flexors, anterior or palm side. So if you see this question on the quiz, just look at the hand. If we're looking at the wrist, the forearm muscles on the palm side, wrist flexors. If we're looking at the forearm muscles on the non-palm side, wrist extensors. And then there's one other muscle, the very tippy top one. It starts up at the elbow, it goes all the way down. This very tippy top one is called the brachioradialis. I know this might seem like a lot of muscles, but in total we have over 600 skeletal muscles. I think I'm asking you to know 30 major ones, all right? These are pretty standard muscles, okay? All right, let's look at the abdomen. I wonder if I can change color a little bit. I'm feeling like changing color. How about orange? People say I say orange funny. I'm from Maryland, so I guess people up here say orange. I say orange. Anyway, if we look up near the armpit, you see right here? It almost looks like fingertips or leaves. These orange little guys are a muscle called the serratus anterior. If you're having a hard time reading this, there's also completely labeled diagrams on Blackboard. For some people, hearing me describe them can be helpful. Boxers have really well-defined serratus anteriors, because actually what this muscle causes you to do is to punch your arm forward. A little bit further down, we have the external obliques. They're on both sides. The fibers run down and in. External obliques. We actually have internal obliques. It's not on your list because it's deeper. And then running right down the middle would be the six-pack muscle, right? It's on both sides. So what I'm doing in red here would be the rectus abdominis. So it will not suffice for you to say six-pack muscle. I want you to tell me what it is, rectus abdominis. All right? Okay. Feel free to pause this if you want to take some notes. I'm going to erase some of the lower names so I can fill in some information about the legs. Let's talk about the legs. Okay, let's first start with groups. Here we have an anterior view. An anterior group of muscles in the thigh collectively is called the quadriceps. It's called the quadriceps because there are 4 muscles. This is not listed in your lab specifically, but make sure that you know collectively they're known as the quadriceps. And then within the quadriceps, we have individual muscles. The one that runs right up the middle here is called the rectus femoris. I'm getting ahead of myself. So the middle quad muscle is called the rectus femoris. The medial quad muscle is called the vastus medialis because it's medial. And then the lateral quadricep muscle is called the vastus lateralis. There is another one, but it's deep so we can't see it, and that's fine. But collectively, these plus one other muscle that you don't need to know are known as the quadriceps. Some ways that people can be helped to remember this is you think of a hot dog in a bun, where the rectus femoris is the hot dog, and then we have the vastus medialis as part of the bun, and the vastus lateralis as part of the bun. But we're not done, folks. We have more. You'll see on your list something called the tensor fascia lata. That is the highest one. So the highest one right up on your hip is called the tensor fascia lata. And we're not done. There's a muscle that runs from the outside to the inside. So it goes over top of the quadriceps. It's not part of the quadriceps, it goes over top of the quadriceps. And it is called the sartorius. This is actually the longest muscle we have in our body. We're going to ask you to know another group, and that group is what you commonly think of as the groin. Collectively, this group is known as the adductors. You know why? Because when they contract, they cause adduction at the hip. Look at that, folks. Like it was meant to make sense or something. I tell you. Lastly, the muscle that's right beside the tibia, right beside your shin bone, there's a muscle right beside your shin bone called the tibialis anterior. It's by the tibia, and it's anterior, so that makes sense. And then on the very outside of the lower leg, we have a muscle called the peroneus longus. Okay? I know it can be harder because sometimes people say the muscles look all alike, but if you just study, okay? Maybe you like to color it in like this. Whatever, draw it, whatever way works for you. Now let's flip over to the posterior view. Let's start with the major back muscles. This here is called the trapezius. So the upper back muscle is called the trapezius, and it gets that name because it's shaped like a trapezoid. The lower back muscle, all down here, the lower back muscle is called the latissimus dorsi. Become familiar with how to spell this. On the longer names, if you get a letter wrong, I'm not going to take points off, but I want you to be close. Okay? The gluteus maximus, come on, people. No one should miss that. No one should miss that, my friends. Gluteus maximus, because there is a gluteus minimus and a gluteus medius, but all you have to know is the gluteus maximus. Now, we talked before about the muscle group on the anterior thigh. The muscle group on the anterior thigh is called the quadriceps. Well, the muscle group on the posterior thigh is called the hamstrings. I'd like you to know that group name. The whole group is called the hamstrings. You only have to know one of the specific hamstrings. Let's go with orange. The lateral hamstring muscle. Lateral means more towards the outside. The lateral hamstring muscle is called the biceps femoris. So remember I said there was the biceps brachii? Brachial means arm. Biceps femoris is by the femur. So this lateral hamstring muscle is called the biceps femoris. But the whole group collectively is called the hamstrings. We only have two left. You're thinking, oh, only? We have our superficial calf muscle. You know it has two sides to it? The superficial calf muscle is called the gastrocnemius. But guess what? Underneath that, deep to it, and you can see some of the deeper ends right here. You can also see some of the deeper ends there, but I'd probably ask you on the side. Underneath the gastroc is a muscle called the soleus, which is under gastroc. The gastrocnemius gets all the credit because it's more superficial, but there's a muscle just as big as important underneath the gastrocnemius called the soleus. All right, folks. If you have any questions, I'm here. There's pictures. There's this video. I know you can do it. Good luck.